Hello and good day, sir. My name is Mariam Attahiru, a student of Iconic Open University from Department of Public Health with admission number 24110085000021. I'm studying postgraduate diploma in public health. I'm here to present a term paper with the course title Introduction to Family Health and Reproductive Health, PGDP 715. So, my question goes as investigating the role of counselor in family planning, counseling, and reproductive health. So, in this paper, investigate the role of counselor in family planning and reproductive health counseling. So, we'll start by introduction. Introduction. Counseling and counselors are regarded as key component of family planning and reproductive health services in developed and as well as developing countries. Counseling is thought to provide clients with new information in an interpersonal context that enables them to profit from it. Also, it helps clients concerned with family planning to make free and informed choices about contraceptions and to act on those choices. The role of the counselor is to make this happen, giving and receiving relevant, accurate information to help clients make decisions and creating the trusting and care relationship with the client that makes this go smoothly and effectively. So we'll start by discussing the concept. What is family planning counseling, and the counseling itself. Family planning is about deciding how many children couples choose to have and when they want to have them, timing of the pregnancy, and birth spacing. The, the focus on quality of care in family planning has drawn attention to the counseling for family planning. Family planning counseling is support to the woman and her partner in choosing the method of family planning that best suits them and to support them in solving any problems that may arise with the selected method. If a woman wants her partner, probably with her partner, is able to make an informed choice, she is more likely to be satisfied with the method chosen and continue to use it. Counseling refers to a process of interaction, a two-way communication between a skilled provider bounded by a code of ethics and practice and clients. It's aimed to create awareness of and to facilitate or confirm informed and voluntary sexual and reproductive health decision making by the client. It requires empathy, genuineness, and the absence of any normal or personal judgments. So, what is counseling? Counseling In counseling, there are few aspects of counseling. The definition of counseling is a therapy session that involves trained therapists listening to a client and helping them to find ways to deal with different emotional issues. To better understand what counseling is, it's important to know the aspects that is the process of the counseling itself, the therapy, and a relationship of trust. So the process, counseling is when a counselor and clients sit or set a time to explore the emotions of a client or a client is feeling and a situation that are concerning them stress and to guide them on how to deal with those emotions. So it's a therapy. Therapy counseling occurs when a counselor examines a client's feelings, expresses and behavior, and helps the client see his issues from a different aspect. That is, when the counselor helps the client to see their problems in a different aspect or a different view or opinion. So, a relationship of trust. When we talk about a relationship of trust, counseling is very important as it requires a lot of trust and confidentiality. Whatever a client tells a counselor always remains secretly confidential or strictly confidential. So the counselor need not to open up to other people regarding what the client has taught him. What is the purpose of counseling? During counseling, clients may reflect on challenges and changes in their lives. As a counselor, you may discuss strategies and methods to help the particular client reach their goals. The purpose of counseling can vary depending on your personality, depending on your specialty. So next slide, we'll discuss the roles of counselors in family planning counseling and reproductive health. The role of counselors in family planning and reproductive health states the role of counselors in family planning and reproductive health. The role of a professional counselor is a very important one. Family planning counseling is to support a woman and her partner in choosing the method of family planning that best suits them and to support them in solving any problems that may arise with the selected method. They speak to many different people and their clients and help their client develop and understand their own issues and situation. So, what are the duties of a counselor? The duty of a counselor includes providing accurate information. So, when providing adequate information, counselor provide individuals and couples with comprehensive and unbiased information about various family planning methods, reproductive health services, and related issues. Two, we have assessing clients' needs. The counselor assesses the client's reproductive health needs, values, and beliefs to provide personalized guidance and support. Three, we have exploring options and making informed decisions. Counselor helps clients explore their family planning opinions, discussing and benefit and risks associated with each method. So the counselor has to make informed decisions that align with their values and goals. Four, we have addressing concerns and fear. The counselor addresses the client's concerns, their fears, and their misconceptions about family planning method. Five, we have providing emotional support. The counselor offers emotional support and sympathy to clients dealing with reproductive health issues such as infertility, pregnancy loss, or abortions. So we also have spacing. That is, the counselor needs to provide clients with information about birth spacing. That is family planning methods. So we also have seven. We have limiting the limit of how many children a client wants to have. We have switching methods. If the client wants to switch method from one method to another method, and we also have addressing discontinuation rate. The counselor needs to provide this information about addressing discontinuation rates of the family planning method. So next slide. Models of family planning counseling. There are various models of family planning counseling. One, we have Gather model and we have Ready model. So I chose the Gather model and the Ready model because the Gather model involves all the necessary informations the counselor needs to have. Likewise, the Ready model. So the Gather model, G stands for greeting the client, A stands for ask about situations and need, T stands for tell about the different methods and opinions, H stands for help client choose the right appropriate family planning he or she needs to have, E stands for explain how to use a method, then R stands for return. While the Ready model, rapport building, explorations, decision making, and implementing the decision. So next slide, we have element of good counseling. A good counselor has element of good counseling, which include focus on the woman's needs and knowledge while building trust, assessing the context of of the problem while exploring options together with the woman, actively listening and learning from her, facilitate her problems and solutions or solving them together, engage in interactive decisions, make a plan of actions together with the client or with the woman, utilize skills ways of asking questions while you encourage and reinforce actions, explore situations and belief. You have to evaluate together your plans of actions with the client. Then do not be judgmental. A good counselor or a professional counselor need not to be judgmental with all information a client provide for him. So next slide, we will look at counseling skills, guidance skills of counseling, and counseling process. One, when we talk about counseling skills, in counseling skills, the counselor needs to have to understand they have two-way communications, forming an alliance with the client, active listening. So the client needs to be very active and to listen to his client. Questioning, the client has to have a certain number of questions or certain questions he or she needs to give the client, ask the client, providing information and facilitation. While guidance skills of counselors, we have self-reflections. The counselor has to have self-reflections, sympathy and respect for the client also, encouraging interactions, building skills and knowledge, share problems and solving problems with the clients too, tailoring or specific needs. Or the client or the counselor has to tailor to the specific needs of that client. Counseling process. A good counselor needs to have access situations, needs to know how to access the situations, define the problems of the clients, needs and information gaps, generate alternative prioritize solutions, develop a plan, review and evaluate with the clients. So in our next slide, assess client need and concern. The counselor needs to greet clients appropriately. Whenever a client is there for any counseling session, the counselor has to have the manners of greeting that client properly. Ensure privacy, confidentiality, and client comfort. A good or professional counselor needs to make sure that his or her client is very comfortable so that his client can be free to express his feelings to him. And he should make sure that he is a very confidential person so that all informations there needs to be confidential, not to be leaked out. Ask about reasons of visit. A good counselor needs to ask about the reasons of visit, ask about partners, home life, family, health, sexual behavior, and HIV status. Every counselor needs to have or address these issues because whenever there is a counseling session, you need to ask your clients about his HIV status. If he or she requires any further investigation, then the counselor needs to provide that information. Ask about plans to have children. That is, if the clients have children or is planning to have more children in the future. Desire for family planning. You should ask him how often he wants to have the family planning. How desirable is he willing to carry out the family planning procedure? Explore STI risks and what client does not avoid STIs. You should ask the client why he or she does not want to avoid STIs because it is a very dangerous and scary infection for a client that comes for any counseling. Provide information to address clients' needs and concern. Inform clients when needs or concerns are beyond health workers' capability. Whenever the client's health condition is beyond the counselor's or the family planning method unit capability, the counselor needs to help the client to further his health information, to pass out the information to the appropriate department he or she needs to see. Advice on how to prevent STIs. The counselor has to advise the client on how to prevent him or herself from STIs. Advice on how to have a healthy pregnancy if client wants to have or wants to become pregnant again. Explain benefit of family planning and healthy spacing. If client wants to have family planning, help client identify methods suitable to her needs or his needs. Give information on methods of interest. Respond to other clients' questions or concerns. So, in our next slides, we'll talk about the element of good counseling. The element of good counseling focus on the woman's needs and knowledge, access the context of the problems with the woman, actively listen and learn from her, engage in interactive discussion, utilize skills ways of asking questions, explore situations and belief, do not be judgmental, build trust, explore options together, facilitate problem solving, make a plan of action together, encourage and reinforce action, evaluate together your plans of actions together with the clients. So in our next slide, we'll discuss about benefits of counseling in family planning and reproductive health. We'll talk about improved knowledge and understanding. Counseling helps individuals and couples make informed decisions about their reproductive health and family planning options. To increase autonomy and empowerment. Counselors or counseling empowers clients to make control of their reproductive health and make decisions that aligns with their values and goals. 3. Better health outcomes. Counselors can help better health outcomes such as reduce unintended pregnancies by avoiding to be pregnant, provide maternal and child health system, and increase access to reproductive health services. 4. Enhance relationship quality. The counseling can provide relationship quality by promoting health communication, content, consent, and power dynamics. Then we'll talk about the next slide. We'll talk about challenges and further directions. When we come to challenge and future directions, the counselor has to be addressing cultural and social barriers. Counselors must address cultural and social barriers that may limit access to family planning services and reproductive health services too. Two, we have interacting counseling into healthcare system. The counselor or counseling unit services should be integrated into healthcare systems to ensure that clients receive comprehensive and coordinated care. Three, we have providing counseling services in undeserved or underrated areas. Counseling services should be made available in undeserved areas such as rural or resource poor communities. When we have strengthening counselors training and capacity. Counselors training and capacity should be strengthened to ensure that they possess the necessary skills and knowledge to provide high quality counseling services. So in our next slide, we'll talk about conclusion. In our conclusion, counseling remains a key component of family planning and reproductive health services. However, counseling is very much more complicated than commonly recognized. Counselors are stress level people. They must bridge the gap, large or small, among the agencies in which they are employed, the clients they serve, and their own identity as members of society. They must improvise on counseling models that are never more than bare bones outlines, and they must provide in a dual sense, carrying out a task and doing so in a way that is creative, realized, achieved, perhaps especially in the field of family planning and reproductive health. They must find ways to talk about or around intimate topics accomplish all this, they draw on structuring resources from the wider society and culture as well as sitting in the way in which they work. Thank you very much.